Dry needling uses acupuncture needles to directly go into dysfunctional muscles and/or muscular trigger points to remove the excessive tightness and pain. We as physical therapists must do a thorough examination of each client to determine if you are appropriate for dry needling. We do this by reviewing your past medical history, discussing your overall health, specific complaints, and your physical level of activity. This is followed by an examination of your physical movement and then the palpation of the area specific to your complaint. When we start the dry needling, we will palpate our specific points in each muscle and mark those locations for insertion of the needles. After we determined the site to be dry needled, we will clean the area with alcohol to prep this for the next step. Our needles are in sterile guide tubes and considered sterile until they leave the tube. We place the tube directly on the skin as we stick the needle into the skin. You may feel a slight sting as the inner needles enter the skin, but due to the very small diameter or width of the needle, most clients do not even feel it enter. You may have a bruise if we go close to a small blood vessel called a capillary, as the skin will sometimes close up before the bleeding stops. You may also feel a latent muscle twitch as the needle enters the muscle. This is an involuntary contraction of the muscle. This occurs as you are releasing some of the pent-up excessive cellular energy of the muscle. We consider this a good thing as it means the muscle is a good candidate for dry needling. We attach electrical stimulation as our next step. We do this to contract very specific muscles. The purpose is to have the muscle contract numerous times so that it can expend all of the cellular built-up energy that causes the muscle to be tight at rest. This is also known as tone. Thus, as a result, you may feel weaker or soreness in some of the specific muscles due to the workout the muscles will have with the E-stim. This is why we ask you to avoid excessive or heavy physical activity with the body part that was treated for at least 24 hours. When the E-stim is turned on, you will feel a thump or slight electrical feeling. We want to turn it up enough to elicit a muscular response. Most clients note that it feels weird, but not painful. The E-stim will last for anywhere between 5 to 15 minutes. After the E-stim is complete, we will remove the electrodes first and then each needle. You may feel a contraction as the needle leaves the muscle, but then you will feel relaxation of the muscle. After everything is removed, we will clean your skin with alcohol. We typically like to massage the area or tape it for support after the session. You may also need a corrective exercise to help enhance the results of the dry needling.